so there are a lot less men who suffer from UTIs. And usually with men, it's as a result of an enlarged prostate. 20% of female sufferers will experience recurrent infections. So there's about half of women getting them, and 20% of those will get recurrent infections. So that's 10% of all women are getting recurrent UTIs and cystitis. That's quite a lot. So to have a look at what we're talking about here, urinary tract infections are infections of the lower urinary tract. So what we're talking about here is the bladder, the urethra, and in men the prostate gland. So if we have a little look at the diagrams below, the urethra, you'll see, connects the bladder, or it's the tube that leads from the bladder out of the body. So it's the tube that we wee through to get urine out of the body. So the infection or the inflammation, because it's not always an infection, will be either in the urethra usually or in the bladder, or for men it can be in the prostate gland, which, as you can see in the left-hand diagram below, is very closely involved in that system. If the UTI is in the bladder, that's when we call it cystitis. So if you're wondering what the difference is between cystitis and a UTI, cystitis is a UTI, but it's one that only affects the bladder. And you'll notice here in this chart that the female urethra is much shorter than the male urethra. So things have a longer way to travel in the men, and you'll see why that's important in a moment. So there are various